Welcome to the 18th meeting of the COVID-19 Committee. We have received apologies from Beatrice Wishart, MSP, who is attending another parliamentary committee. This morning, we are taking evidence from the Cabinet Secretary for Constitution, Europe and External Affairs on two SSIs, the Health Protection Coronavirus Restrictions and Requirements Scotland Regulations 2020, SSI 2020/279, and the Health Protection Coronavirus Restrictions and Requirements Scotland Amendment Regulations 2020, SSI 2020/300. The Cabinet Secretary is accompanied by three supporting officials from the Scottish Government: Professor Jason Leach, National Clinical Director; Rebecca White, Health Protection Coronavirus Restrictions Regulations Coordinator; and Luke McBratney, Bill Team Leader, Coronavirus Scotland Bills. Can I welcome you all to the meeting? And Cabinet Secretary, please can I invite you to make an opening statement?
Thank you, Convener, and thank you for the invitation to be back at the committee again and have the opportunity to discuss even more regulations which adjust to national restrictions which are in place. The regulations we're talking about today revoked and replaced the previous lockdown regulations, providing us with a consolidated set of regulations with a new expiry date of the 31st of March 2020. The regulations impose additional restrictions and requirements on members of the public and businesses. The strengthening of rules and mitigations we have in place are required at this time to help keep the virus under control, and of course there will be further announcements about that later today. As usual, this committee, this is retrospective in terms of regulations which are already in force, and I will come to that point later on. The Scottish Government made these regulations by way of the made affirmative procedure on the 11th and the 24th of September. These regulations entered into force on the 14th and the 25th of September, and a plenary vote will take place in due course. These regulations make a number of adjustments to the previous restrictions and requirements that were in place, and they introduce additional measures that are necessary. They mandate that specified hospitality settings must close between 10 p.m. and 5 a.m. and should only serve food and drink for consumption on the premises if it is to be consumed at a table. Customers and staff must now also wear a face covering in certain circumstances. The regulations allow marriage and civil partnership receptions and funeral wakes to take place with slightly larger numbers than before, as a household limit on those does not apply. These regulations also adjust the rules regarding social gatherings, restrict indoor private gatherings from taking place in most circumstances, set out that outdoor and public indoor gatherings made up of more than 6 people from more than 2 households are restricted, with the exception of some limited circumstances. Finally, these regulations provide some greater freedom for those under 12 and those aged 12 to 17 by setting out circumstances when the 2-household or 6-person limit does not apply. Now, Convener has set out in the updated route map, there are some changes in Phase 3 where we have not yet confirmed a date for which they will come into force. And indeed, whilst the next review date has been set at the 15th of October, the First Minister will be making a statement later today to the Chamber, and that will give the current position, including information about actions concerning the deteriorating situation. Now, finally, can I turn to the issue of scrutiny, which I know members will wish to raise and raised yesterday with me in the Chamber when I made my statement on the legislation. Members have raised genuine concerns about the current process in Parliament to consider all these emergency regulations. As I said yesterday, I have now written to the presiding officer, to party leaders and to the conveners group, asking for nominees to attend a meeting, which I hope will take place this week, to work in collaboration and develop options for what kind of enhanced scrutiny arrangements we can develop. However, we must recognise we're dealing with a public health emergency, and we must have the ability to act without delay when the clinical advice indicates that urgent interventions are required. The government has made every effort to be accountable to Parliament on coronavirus matters, and I will take forward the work to improve that accountability as quickly as I can, in order to try and find what I hope will be a mutually agreeable solution. Convener, I hope that has been helpful. I'm lucky to have with me today Jason Leach, Rebecca and Luke, all of whom can answer in more detail than I can on certain aspects of the present situation, and I'm sure that all of us will do our best to address the questions that you have for us. And as usual, if we can't, we will find a way to provide that information to you as speedily. Thank you.
Thank you, Cabinet Secretary. And I will now turn to questions. And if I may begin by asking the first question. you are aware, as you said, that we discussed the possibility last week of the Scottish Government introducing in the form of a circuit breaker over the October break. And you made reference to the First Minister's statement this afternoon, when further detail will be given. Do you accept that there has been a degree of uncertainty about when, whether, and in what form this circuit breaker would go ahead? And do you accept that the public, in order to buy into or to consent to these measures, need clarity over any new restrictions?
Yeah, I'm sorry, Camille, you were breaking up during that, but I think I got the question. I think, to be fair, I think I did address it yesterday in the statement I gave on legislation, but I'm happy to do so again. I think in answer to Anna Sarwar yesterday, I indicated I thought there was probably a thin line, and I suspect you and I would agree on this, between speculation and discussion. I think it is inevitable that there will be questions about what actions need to be taken, given the deteriorating situation, which I've referred to earlier today. I think that is absolutely essential that there is that discussion. I think as leaders, and you know, we are all in our communities leaders, elected members of the Parliament, I think we have to be careful that we don't stray too far into speculation, and that we accept the role that we have in trying to create the right atmosphere so that everybody can comply with necessary regulations. I don't believe that for a moment that any of the regulations that I've been coming to this committee with are in any sense superficial or unnecessary. I think they are essential. I think that we have shown more than willingness to discuss them very openly. I think there is room for ever more information to be given to support the very difficult decisions that are being made by the First Minister, the Health Secretary, her advisors and the Cabinet. But at the end of the day, it will be up to the Parliament to decide whether or not to do that. So I think we've all got responsibility. And I know, you as a responsible person and convener of this committee will recognise that. We all have a responsibility to explain what is happening. We've all got a responsibility to be careful in what we say.
Thank you for that, and I apologise for breaking up, I gather. Can I perhaps direct the next Can I direct the next question perhaps to Jason Leach on the same subject of a circuit breaker? Professor Leach, you said last week that, and I accept you were talking about perhaps a more extreme circuit breaker of the stay-at-home order, but you said last week that the international template for that is that when the R number is just over 1 and that it's a 2 to 3 week endeavour. Now, it appears that from what we said yesterday, that the Scottish Government are no longer considering a stay-at-home order, but it's obviously still a possibility. Can I explore two matters arising from that? Firstly, what's your view of at what point does the R number mean that a circuit breaker is effective? And secondly, what's the time frame for stricter measures like a circuit breaker? What's the optimum time frame if you want to make any significant and worthwhile impact?
Thank you, Convener, and thank you for asking me to come back in support of Mr. Russell today. I unfortunately have to start by saying I only know some of the answers to your questions. The unfortunate thing about this virus is it is young, and we learn every week, as we've discussed on this committee before. The modelling from SAGE, the scientific advisory group that informs all of the 4 country responses, and the modelling from other places like the European CDC, the American CDC and the WHO, suggest that you should first of all endeavour to do 2 things. Get your prevalence down, so just the raw numbers. So get from 800 a day back down as fast and as quick as you can. And then, at the same time, reduce your transmission rate, which is a slightly different thing, because that is the risk of people giving it to other people. You need to do those 2 things simultaneously. Unfortunately, the only 2 things we have to do that are human behaviour and test and protect, test and trace around the world. So if you can take a moment in time, the modellers have done that. So the modellers look at, would you have to do something for 12 months or 2 months or 2 weeks, and what do you get depending on the time scale and the nature of the restrictions. Now, that can't be an exact science. It's impossible for it to be an exact science. And they've looked at all of those. So the modelers helped us to get to where we are. They helped us to reduce the numbers in the summer, and that worked. So we know that lockdowns in Portugal and in New Zealand and in Scotland brought the numbers down dramatically. But then there's a moment when you have to reopen. And now you play a balanced game, and you heard Chris Whitty, perhaps some of you a few weeks ago, say out loud at a press conference, we have reached the edge of what we can open without prevalence rising. And it turns out he was correct. The numbers across the whole of Europe, 350,000 last week, increased deaths, increased hospitalisations, and Scotland, unfortunately, is not exempt. So now we have a real challenge in what we do next. Do we do national restrictions for a long period? Do we do regional restrictions for a long period? Do we do a mixture of all of them? Do we do national, perhaps for a short, sharp period to get that prevalence down again and then slowly reopen? And all of that advice from Gregor, Fiona and I, from the Chief Nurse and the Chief Medical Officer, feeds into economic advice, social advice, into Mr Russell, his Cabinet colleagues and the First Minister to decide. The final thing I would say is I think circuit breaker has become a little bit iconic, probably unnecessarily, partly because we were asked about it a lot and we had to respond to the questions. What the fundamental science is if you do more severe restrictions for a shorter period, you may be able to come out of them a little bit quicker. That's the basic principle. So if you can, with support and with help and with all the other things to deal with economic effects, if you can short, sharp, reduce the prevalence quickly, and this virus works in 2 to 3 week chunks, so that might work, then you can come out the other end and you can slowly open again. That's the scientific principle.
Thank you very much. That's very helpful. My final question is about a written submission that the committee has received from a gentleman, Mr. John Hunter, who's concerned about the new restrictions introduced by the second SSI that prevents people from having visitors in their homes. He's particularly concerned that he's not permitted to see his 4 adult children in his own home, which he considers to be a basic human right. Can I ask, when the government was developing the restrictions on private dwellings, did the government consider creating an exception that would allow people to be visited in their homes by their nearest relatives for someone like Mr. Hunter?
I'll ask Jason to say a word or two about the science behind that and the evidence behind mixing in households. But of course, all the options are on the table every time these matters are discussed. They have to be. But you do illustrate a point there. If his 4 adult children all have their own households, for example, then, I'm by no means a mathematical genius, but it does occur to me that, the possibility of spread is multiplied by 4. And therefore, even an even larger family, you get into that situation too. So I think you have to be. I addressed this question, I think, the last time I was at committee from Willie Coffey, who had asked about a constituent of his, an old lady who had 2 friends, and they didn't see why they couldn't sit and have coffee in one of their houses. There is an increased danger. There will be an increased danger. And Jason can give us the details of the science of it, but it is a plain fact that the more people are involved in that and the more households are involved in that, the more the risk will be. And I accept it's extremely hard. And every constituency MSP who is at this meeting knows that there will be cases brought to them which are even more heartrending and even more difficult to deal with. But there are some facts within this that we have to be honest about. And one of them is the dangers increase each time an additional person is added, an additional household is added to that mix. But perhaps Jason would like to underpin that more general remark with some scientific fact.
And some emotion, perhaps, before I do the scientific fact. I don't think it's an exaggeration, convener, to say that in amongst a series of impossible pieces of advice, the 2 pieces of advice that I have found most difficult are the restrictions on visiting in care homes and the restrictions on people visiting each other's houses. I mean, it is unprecedented for public health advisors to tell decision makers in a country that you cannot visit your mum or your children or have your 4 adult children around. So I have enormous sympathy with Mr. Hunter. People in my own family write me letters, not quite, but they outline exactly that scenario much, much closer to me. This is not an abstract concept. It affects your family, it affects Mr. Russell's family, it affects Mr. Hunter's family. The reality, though, is that every time 2 separate households come together, there is risk. That can be reduced by it being outdoors. It can be reduced by it being well ventilated. It can be reduced by it being distanced, but it cannot be eliminated. So if you have environments where people are indoors, warm, poorly ventilated, perhaps drop their guard a little, perhaps just come a little bit too close together, that's where we see household clusters. And it is horrible. It's horrible. But let's be clear, the fault is with the virus, not with the instruction and the advice. It's the virus that causes us to need it, and I want it removed just as fast as it can be removed. But the numbers just now do not allow the advice to change. Household mixing is the principal risk. And I feel nothing but misery for Mr. Hunter's position, and I want those restrictions removed just as fast as we possibly can, as does Mr. Russell.
Can I just continue to make an additional point? We have recognised some of those difficulties with ensuring that there is the concept of extended families, and and that has been helpful to some, and particularly those who live on their own, and that is an important element within it. But everything that can be done to edge that. Also, I think the Health Secretary indicated last week he has been continuing to talk to the relatives of those in care homes and to the care homes themselves about how visiting can change and develop. This is not static. Everybody is trying to do as much as they can. But as Jason has indicated, the virus is not static too. And that is the element that we have to defeat.
Thank you for that. And thank you for that last point. I mean, I think Mr. Hunter's response would be that extended households can only be formed with 1 child. I think that's right. And therefore, that just, in his particular circumstances, that doesn't help him. Anyway, but thank you very much for those answers. Can I now turn to the Deputy Convener's questions? Monica Lennon, please.
Thank you, Convener. Good morning, everyone. Despite the regulations that we're taking evidence on today, which do restrict visiting other people's homes with some exceptions, and the curfew, the 10 p.m. curfew on hospitality, the Cabinet Secretary has advised that we are in a deteriorating situation. So can I go back a little bit and ask what modelling was done on these particular regulations? What were ministers advised in terms of the possible outcomes? And Professor Leach explained to us last week that when there is modelling done on possible interruptive actions like circuit breakers, it can tell you how much time you might be able to buy, or in terms of the number of days of lower risk that you might get in your pandemic. So in terms of the restrictions on household interaction and the hospitality curfew, what did we hope to get, and have we fallen short of that, Cabinet Secretary?
Well, I think Jason Leach, Professor Leach, indicated that last week when he last gave evidence, exactly where those things are. So it might be helpful if he just rehearsed that again, exactly where we were. This is inexact, of course. The virus moves, as fast as decision making, and some might argue faster than decision making. And in those circumstances, you have to react to where you are. I suppose, in the sense of, you have to, in the golfing analogy, play the ball where it lies, and it now lies where it is, and we have to make sure that we are equal to that. But could I ask Jason perhaps just to reiterate what and to rehearse again what he said last week, because I think it was an important contribution to this.
It again is exact. My answer will be unsatisfactory. It's unsatisfactory to me as much as to anybody else. The modelling is exactly that. This is modelling. It's now based on more real numbers than it was in March and April, of course, because we have more numbers. We now know much more about the virus internationally and locally in Scotland. We know where it spreads, where it likes to spread, but we cannot eliminate that completely. We also know a lot more about compliance, about how people behave when you use TV adverts, or you have to, at one extreme, use the police, but much more likely use powers of persuasion and communication. But that compliance is not 100%. There isn't any question about that. No country has 100% compliance. We are hopeful that the restrictions that this committee is today considering will bring R down and the prevalence down. But the reality, whether I like it or not, is the numbers continue to rise. Now, the National Incident Management Team looked at the West of Scotland numbers. Remember, the Lanarkshire restrictions have not been in for that long. The national restrictions haven't been in for that long, 2 weeks or so. And the virus has an incubation period of 7 to 14 days. So we're only in one incubation period. And that wouldn't show the numbers suddenly turn a corner. And in the middle of that, we had the pause of residence outbreaks. So we've had considerable work that's gone on in higher and further education. The acceleration has slowed in the West of Scotland, but the numbers are still high. And we get worried, the public health advisors, when we see numbers of 700, 800, 850. And that concerns us. And that's why the advice today to the First Minister and the Cabinet is that we should do something extra, which we will hear about later today.
Thank you both. So can I just ask then, in terms of the restrictions on household visiting and the 10 p.m. curfew, do we have any idea how effective those two measures have been? And perhaps you could say a bit more about compliance. No one would expect it to be 100%, but what do we know in terms of compliance? And can you say a bit more about human behaviour, and is the public meeting government's expectations at the present time?
I think that the compliance issue is a very important one. Police continue to argue that the 4Es approach is the most effective approach that you could have. We have the basic figures. I'm just trying to secure them here because I know I have them somewhere, but of course there's a great deal of material around. But we know that from those basic figures that the actual incidence of ensuring that there are penalty notices issued is comparatively small compared to the engagement that the police have and the way in which they can persuade people to react. The regulations also include, of course, actions that can be taken by the police in terms of larger gatherings over 15 and so-called house parties. And those have been very important in intervening in those circumstances. The evidence also shows, and this is evidence that I think needs to be, and I'm sure will be made available. The evidence also shows, and Jason can no doubt talk about this too, the evidence also shows that the transmission is, as he has said, in households, and that is the area, so to speak, of greatest danger, but there is transmission in hospitality and licensed premises as well. And wherever people gather together, where there is ventilation that perhaps isn't quite as effective as it might be elsewhere, the windows aren't open or there isn't that type of ventilation, where people are, the disinhibiting effect of alcohol may mean that people will move more close to each other than they would otherwise do. In all those circumstances, that is a risk, and that is a risk that creates difficulties, and the figures show that. And there are other circumstances, but they are also less severe. You know the restrictions that exist on travel, international travel. And people coming in, that was an element, a stronger element. A month, 6 weeks ago, it's not as strong an element now, but it is still obviously an element in there. So all of those things come together, and there's a judgment then, and these are all judgments. There's a judgment then about how you would be able to deal with those as the places in which there is maximum risk, and how you actually move on from there. And that is what is being considered. Now, at the end of the day, if people won't accept the regulations, they won't accept the guidance they get, then there has to be some ability to enforce. It is with the greatest reluctance, but enforcement does take place. And the figures are published every week on this, but I'm happy to make sure that Monica Lennon has the latest updated figures. I don't know if Jason Leach would want to add to that.
I would add that in answer to your final question, Monica, I think the Scottish public have exceeded my expectations in general. the confidence in the messaging, the ability to repeat the messaging back in the polling, the facts campaign, the ability for people to understand the nature of the virus, I think has exceeded my expectations. And if you look at our polling compared to the international numbers, that messaging and understanding of the people has gone very well. And the WHO say they have 6 things that you have to do to come out of the pandemic. Of course, some of them are prevalence and test and protect, but one of them is you have to take the population with you. There is no point if you have to regulate not by consent. That won't work. Now, that doesn't mean there aren't 300 people house parties that the police should have the powers to break up. I completely support that on the edge of what we're doing. But the vast majority is about bringing the people with you, explaining to them why, not just what. And I and many others have spent the last 9 months trying to do that every single day. And when that message gets undermined in whatever way, then that makes that job slightly more difficult. The compliance is quite difficult to give a number for, and I think it varies depending on what the instruction is. The polling says that most people follow the rules. When we've introduced face coverings, people have done that. People now wear them on public transport. They wear them in shops in the main. It's not 100%. We did have some challenges. Some of the UK-wide polling says that people weren't quarantining when they came from overseas. It wasn't exact numbers. And when we phone people and when we've been emailing people, people have in the main been compliant, but we can't know that for sure. And now the numbers of cases that have come from international travel has reduced significantly. That's partly a result of the school holidays being over, of course. But we have to continue with compliance. And my instinct about compliance is most of that should be sector-driven rather than police-driven. So hospitalities should drive most of that. They should have the COVID officers. They should speak to the staff. They should speak to the customers about how to keep that area safe. That's much more likely to work than if we send in police into hospitality settings, for example.
Convener, perhaps I have the figures that would save perhaps Monica Lennon having to look at yet another email from me. The 27th of March to 30th September, that is the full period. The police, this is from Police Scotland's website, they dispersed when informed with 56,991, so those are people who perhaps just didn't realise. Dispersed but when instructed, 14,476. Dispersed using reasonable force, 492. Issued fixed penalty notice, 3,602. And arrested, 333. And I wanted just to quote Ian Livingston, the Chief Constable, who said, the great majority of people are taking personal responsibility to do the right thing. But he went on, and this is specifically about house parties, but it applies more widely. There can be no excuse for arranging, attending, or hosting a house party. It's against the law. Where officers and council encounter blatant, willful, or persistent breaches, we will take decisive action to enforce the law. I think Jason Leach is right. It is self-policing, it is self-regulation, it is sector-driven. But in the end, there are penalties for breaches of law, and that's how it should be.
Thank you. And in the interest of time, I'll leave my questions here for now. Back to you, Convener.
Thank you, Monica. Please, can I turn next to Annabel Ewing?
Thank you, Convener. Good morning, colleagues, and to our panel. I have 2 questions, and I'll say what they are, and then both witnesses can decide who's best to respond. My first question is about the household restrictions and specifically impacts on mental health and well-being. And I just wonder, prior to them being introduced, what assessment was made of likely impacts, and further to them having been introduced, what ongoing assessment is being made? Appreciating it's not an exact science, but it just would be interesting to hear. And secondly, what will progress look like? What will success look like? I was interested to hear Professor Linda Bauld yesterday, I think it was on the Call-K programme. I think she referenced, and I was making a cup of tea at the time, so I might have missed a few bits of it, but I think she referenced the approach of, for example, Germany, where specific targets are set, and then there's a benchmarking. People know if they've met them, they haven't, and if they have, what will happen next. If they haven't, what won't happen next. And I just wonder, if that's has been a consideration on the part of the Scottish Government, that might be a way to continue to have this really crucial dialogue with the people of this country to ensure buy-in and compliance. And in that regard, it just occurs that the outdoor restriction of 6 from 2 households, from my memory, was introduced at the same time as that was introduced for indoor mixing. I think because it was felt inter alia that it would be an ease of messaging. But because we've now taken away that indoor possibility, why do we still have the 6 and 2 outdoor? Would that not be a possible area, even though the weather is going to be awful? Where there's a will, there's a way, and that may be helpful to folk to think that they could actually meet a few more people outdoors. Thank you. Perhaps we could start with the CAPSEC.
Let me touch on those and then ask Jason to come in and again fill in the detail in terms of the evidence. I don't think there is any doubt that what in the end the decisions are about are balance of harms, balance of risks, societal harm, individual harm, economic harm, health harm, and it is balancing those. And I think we're all very aware of the mental health harm. Because the ultimate harm is, people die of this, and that is, a harm from which there cannot be recovery. In every other harm, one of the issues is, can mitigating circumstances or actions be taken? So it is the balance of harms, and we are very, very aware at the moment of decision on this, what the balance of harms are. The Cabinet met yesterday and indeed met again this morning. And, that is an issue that is never far from any of our minds, and I know absolutely not far from the First Minister's and the Health Secretary's minds. These are really, really important issues. Success will look like getting ourselves through and beyond this into some new normal. Now, whether that is dependent upon there being a vaccine or not, is clearly a major issue. But success means getting there with also the minimum damage to our fellow citizens in each of those areas of harm. And, unfortunately, massively regrettably, there will be harm in each of those areas. How can we minimize those harms? And how can we get ourselves through these circumstances, which are unique in our experience? I mean, no Scottish government, no government in living memory has had to face these circumstances in precisely this way, in this difficult way. And it is therefore balancing those harms that are the real issue. In terms of the outdoor consideration, I've heard this argued. I think it is again minimising harm, reducing numbers, and making sure that in outdoors, which is a safer environment than indoors in these matters, there is more flexibility and more ability. But again, Jason may wish to say more about that.
There's a great deal in these 2 questions, Ms. Ewing, and they're excellent questions. So let me reassure you, first of all, that mental health overlay, mental health considerations are never far from us. Ms. Hawkey, the Minister for Mental Health, is often in these conversations. We have a senior medical officer whose only job is to bring us the mental health data and the mental health considerations of these decisions. Not somebody who you would know prominently in the media, but somebody who is in a lot of this decision-making for us. We have the same for each of the medical specialties and other healthcare specialties you would expect. One of the reasons for the exemptions to the indoor rule around informal childcare, non-cohabiting couples, extended households for single people, and those who just live with children is exactly that. Other countries have done more extended bubbles. We have looked at that a couple of times with the modelling. I don't think that's a ridiculous idea. I don't think the prevalence just now is the right time to do that. But if you got to a point where your prevalence was very low, then that might be something Scotland would think of. And we have thought about that a couple of times before, and we've rejected it for risk reasons, not for any other reasons. Your success question is, of course, excellent. Final success is what Mr. Russell's just said. Science will get us out of this, and crowds will come back to stadia, and we'll be back out in restaurants, and the pubs will be full. I have absolutely no doubt that will come. There is hope. I don't know when it will be. I think the most likely scenario for that to begin is the spring of 2021 and into the summer of 2021, but I don't know that for sure. The kind of medium-term success around what we might do around levels, which is what you're describing in Germany. The Republic of Ireland have just done a similar thing. We are in consultation across the whole of the UK, the First Minister, the Cabinet Secretary for Health and the advisors, talking to the other countries about a levels-based system. There are attractions to that. It's very clear, it's understandable, it's easy to communicate. There are some disadvantages because the virus unfortunately doesn't work in factors of 50 or factors of 20, and you may have to nuance some of that. But we quite like the idea of the clear communication of a levels system. I have to tell you though that today we would be breaking through most of those levels. You've heard us talk about 20 per 100,000 when we restricted people coming from Greece or France. Most of our local authorities are now over 50 per 100,000. So the levels thing only works if you're in quite low numbers, and we're not. We're at quite high numbers. So I think as we come out again, if we think about moving back to a route map that is easing rather than imposing restrictions, then a level system may well be one of the things that we think about, even across the whole of the UK.
I thank Professor Leach and the Cabinet Secretary for their answers. Very interesting, food for thought. Just make 2 quick points. I appreciate other colleagues have their own questions. One is on the important issue of mental health. I think it would be helpful. I mean, it's good to know that that is factored in at all times, but I think it would be good to see more information about that so that the people of Scotland are indeed aware that that is absolutely being considered every day down the line, and I think that would be helpful. And secondly, just a plea, when we get, hopefully I'm an optimist in life, to the stage that we can see a bit of wiggle room, can we please consider very seriously the idea of multiple, at least more than one, extended households, because I think that already as a key measure would make such a difference in people's lives. Thank you. Thank you, Convener.
Thank you for that. Our next questions are from Shona Robertson.
Good morning, everyone. I want to just go back to the theme that Monica Lennon was touching on around public consent. And I think the First Minister said herself we're entering into quite a tricky period in maintaining those levels of public support, and I guess just a sense of weariness. So how do we do that? And obviously it's not just government's role to do that, but for us all to have a part in doing that. And is there any evidence that the public's understanding has been affected in any way because of the local variations, in terms of we've gone from a consistent one message to through different local measures, and is that impacting on the public's understanding, and are you testing that? And on Monica Lennon's point about compliance, there used to be a percentage figure that was used in the early days that had to be reached in order for these measures to be effective. Is there still a percentage compliance figure that the Scottish Government works to in order to be assured that enough people are adhering to enough of the measures in order to ensure that they're being as effective as you would need them to be?
Let me address the first half of that very directly. Clearly, all of us are weary, and it would be foolish for any of us to say that we woke up every morning, fired with new enthusiasm to talk about regulations or restrictions. That all of us are weary of this process. But it doesn't make it any the less necessary that we take these forwards. And that is what we should focus on. And the role of each one of us, and I go back to this point, as community leaders, as those who are able to and have the opportunity and the privilege of representing other people, have to make sure that there is an understanding, a clear understanding of the imperatives here. politics works its way into everything. But all of us as representatives also know that people want to hear the truth, and they want to see people working together to try and solve what is the most extraordinarily difficult, complex, problematic period, distressing period that we have ever been through. So, I bounce the question back to members of this committee. It is all our roles, and this committee membership perhaps most of all, of making sure that people understand why the rules are in place. Of course, interrogating whether those rules are necessary, and making sure that those who are making these decisions are fully accountable and are able to argue for it. But once that is done, making sure that those rules are understood and complied with, in the sense of persuading people to do so, and supporting the police in the 4E strategy and others who are involved in enforcement, so that people can be engaged with, they can be persuaded, they can be enlightened. That's an E that we haven't used. They can be enlightened about the purpose for that. And I do support very much the publication of more information, a matter I think raised with me yesterday by Monica Lennon and other members in the Chamber, the publication of more information that tells people how essential and necessary this is. In terms of the second part of the question, perhaps Jason Leitch would be best placed to answer it.
I agree completely with Mr Russell around the clear messaging. Frankly, Ms Robertson, the 23rd of March was easier for the public health advisors than the 7th of October. It is much easier to tell the country to stay at home. The messaging is clearer, not the actual message. Of course, it's much, much harder. As the message gets more complex and more nuanced, the behavioural scientists tell us that we should use every mechanism available to us, and we should repeat those messages every day. And repeatedly. And that's why, whether you like it or not, that's why you hear me on your phone-in shows, and you hear me on TV and radio, and you hear Gregor repeating those messages. I think it is all of our job, parliamentarians, including those in Cabinet, but also in a select group of public health advisors, to be part of the public voice of that. And that's why I and a couple of others have put our heads above the parapet, to occasionally be got off, but to try and get that messaging across to the public as best we can. And I think our polling would suggest that that balance between the First Minister's briefings, other people doing some of that messaging, and the public health messaging is as far as you can get it to working. But the challenge now is the message is much more complex, and we've been at it for 9 months. I'm fed up. Everybody's fed up. So that makes it really difficult to get compliance. And it takes me to your second question. We don't have a single number. It was slightly easier when the message was stay at home, and we could count the number of people on public transport. We could count the number of people who were literally at home and only going to the supermarket or exercise once a day. Now, because some workplaces are back, some sport is back, some kids stuff is back, that single, this is how many people are using public transport, this is how many people are at home, becomes much more difficult. So we have to be slightly cleverer about compliance around our polling data, around house parties, around how many pubs are managing to keep the distance, all of those things which we discussed earlier.
Hey, thank you for that. Just a further question for Jason Leitch. You'll be aware of some of the media reporting over kind of recent days, and there's some in the UK media, particularly today, around this kind of idea of a split in the medical and scientific community about the best way to deal with the virus, bluntly. I guess it's just an opportunity for Jason Leitch to really tell us whether, the overwhelming consensus among the medical and scientific community is still that this requires an interventionist approach in order to contain the virus. I think it concerns me that there could be a perception given to the public that somehow the scientific and medical community are all completely disagreed about the way forward on this. It would be helpful to hear Jason Leitch's view on that.
So the headline answer is the mainstream scientific advice from around the world is that this virus remains a major threat to global public health and individual lives. You can go from the WHO through the European Centre for Disease Control to the governments of Europe or the governments of Southeast Asia, and you can find that same message. You will not find a country, a whole country, that has veered from that very, very much. There are nuances. Sweden is often the one quoted to me. I said to the chief executive of Swedish Healthcare, people are telling me you didn't lock down. And he said, no, we locked down. We just have a very compliant population. We didn't have to put it in law. So every country in the world is doing the same thing. Now, what is happening, of course, is scientific disagreement is playing out in the public eye because it is a global pandemic. So my world of head and neck surgery, we've always had scientific and clinical disagreement, but it happens on the pages of journals and nobody ever reads it except us. This one is playing out from the British Medical Journal to the Today programme to GMS. And I think that's okay, as long as there is balance in the reporting and balance in the messaging, and the public health, the mainstream public health message is heard. I have no difficulty with being held to account for that advice, none at all. But we need to be careful. Some of the more extreme versions of let's just let this virus fly, face coverings don't work, distancing is nonsense, I think that needs control. That really needs very strong other voices to make sure that isn't heard by too many people in the country. But that doesn't mean that disagreements between public health professionals about exactly what restrictions you should have or the timing of those restrictions, that is healthy in the scientific community. It's then quite difficult when you want to tell 5.5 million people to do something. And that's why, with Mr. Russell, I'm keen for as much data as we can get, as much evidence as we can get, so that parliamentarians and the citizens understand why we're making those choices.
Okay, thank you, Convener.
Thank you, Shona. Our next questions come from Mark Ruskell.
Yeah, thanks, Convener, and morning, everybody. You've written to the committee identifying those route map changes which are under constant review at the moment. And just looking at the list here, one of them is around contact sports for people aged 12 years and over indoors. Now, there's obviously a range of circumstances that can change, but one of those which is foreseeable is that the weather is going to change. The weather's already changing as I look outside the window. The Education Scotland guidance that was issued this week reinforces that ban on all indoor contact sports for over 12s, but it also extends that to under 12s. So I wanted to ask you whether you foresee that's going to create problems as a term running up to Christmas, where you've got teachers under pressure, you've got primary school children unable to do contact sports outdoors because of the weather or indoors because of the current guidance.
Well, I'd make 2 points. One is the weather is a very, very substantial disincentive, but it's not a complete disincentive in Scotland for outdoor activity during the winter. But I accept that it is not nearly as desirable as in other times of the year. The second one is, quite clearly, the advice that the Cabinet Secretary for Education will have this is germane to it. I think it would be most helpful to you, Mr. Ruskell, if I was to ask for that to be shared with you, for him to be in touch with you about it. I think it will create difficulties, but he really is the person that should respond to you on that. I would just caution against the view that there would be an absolute impossibility of outdoor sport during the winter.
Thanks for that. Of course, there are primary schools that don't even have outdoor facilities, so they're already in a disadvantaged place.
That's strictly true. There are primary schools that there's a legal requirement for a certain amount of outdoor space for primary schools. It's something I happen to know as a former education secretary. So it may be constrained and difficult. I do accept that, but there should be anyway some outdoor space for every primary school.
Okay, I'll just move on to, sorry, unless Professor Leach wanted to come in on that.
I was going to actually add two things. One is I think we should write to you, actually, because I'm not aware of that. I can't keep up, if I'm honest, with all of the regulation and all of the advice. There's just simply too much of it to keep on top of it every single day. So I think we should write to you about the detail of that particular thing you asked about. So get us that and we'll get back to you. My principal advice is children is safer, outdoor is safer, but indoor contact sport for kids has been allowed. So we think in the round that is as safe to do as some other things. And I, like you, I'm very keen to allow that to happen for physical activity, for mental well-being, for all the other things we know about. Outdoor contact sport allowed for all ages at this point. And that was a big step, particularly for adults, because that is a risky area. There isn't any question. That's one of the exemptions we've given to contact sports. But let's look into the specific one about the under-12s for you.
I think that would be very welcome, because the guidance was issued this week, 5th of October, I think it was, in relation to that. So it's certainly being interpreted by primary schools that they can't do indoor contact sports. If I could move on to something which is in the regulations, and that's the 10 p.m. curfew. I'm just wondering how we're actually monitoring the effectiveness of that. I used to sit on a licensing board, and there was always a concern around having an early closing time, because what can happen is you get a big surge of people at chucking out time, moving through licensed premises to the exit, congregating at taxi ranks, kebab shops and everything else. Obviously, that causes an issue in terms of alcohol licensing and the duties that you need to consider on that side. But I'm wondering what the knock-on effects might be of that in terms of COVID, particularly if people are then going on to house parties afterwards at 10 p.m. So I'm just wondering, how are we monitoring this? Is there a role here for licensing standards officers? Is it the police? Is it the licensing trade themselves saying, actually, this is working fine, or we're having trouble enforcing social distancing because there's a huge number of people that are just leaving at 10 o'clock?
Well, can I make it clear that the only counter to that argument in terms of what would happen at 10 o'clock is no closing hours at all, because the same holds true at 11 o'clock, it would hold true at 9 o'clock. There are issues of people exiting premises, at any time and congregating together when those premises are closed. It is, as Jason has said earlier on, the first and best monitoring and support of this comes from the sector and the trade itself. The sector and the trade itself want its customers to be healthy and to continue to be available as customers, so they will want to make sure that the regulations work, and that means making sure that everything they can do in terms of social distancing and enforcing social distancing and regulating this is taken. But then, there is a legal imperative, and, we are discussing regulations here as legislators. There's a legal imperative. Not only is that to happen, and therefore should happen, and the licensing board has a role and the police have a role, but in addition, there are regulations on social distancing, which need to be observed as well. And it is also, up to individuals. And I just want to stress that, something perhaps we don't stress enough. This is for individuals' safety. Nobody wishes to be infected by the virus, given the consequences that can exist, even for younger people, as we know. So in these circumstances, individuals who are in public houses at closing time need to make sure that they keep themselves safe. We've also increased the requirement to wear face coverings when moving about, when not at a table and not consuming alcohol or any drink or food, and that is an important part of it as well. So, on a circle of monitoring, the circle of monitoring starts where you are, with yourself, and then the circle of monitoring and observance spreads out. And there are lots and lots of rings in that circle, but the best ring in that circle is a central one. It is up to you. You should keep yourself safe, and the regulations and the guidance are there for that purpose.
Thanks.
Mark, have you got any further questions, or are you complete?
No, that's it. Thanks.
Could I turn next to Willie Coffey, please?
Thank you very much, Convener, and good morning to everyone. If I could ask maybe a couple of questions to the Cabinet Secretary, and perhaps one to Professor Leach, Cabinet Secretary. Our shielders have been pretty much withdrawn from most aspects of our society now for 8 months or so, with some relaxation, of course. Do you see any new advice coming out for our shielding group, given that the numbers have been rising quite rapidly over the previous few weeks?
I think it is very much our intention to try and make sure that not only are people safe, but people can do as much as possible. And therefore, the differentiation between those who are shielding and the general population, we've tried to make sure that as much participation as possible can take place. I think Jason should probably address that from a medical standpoint as well, because obviously that will be a medical issue and a clinical issue in terms of how we can help and protect people at a time when the situation is deteriorating. Clearly, the best thing to do is to stop that situation deteriorating as rapidly as we can. But I think that would be a clinical issue that Jason would want to address.
Shielding was a very blunt tool, Mr. Coffey, and we always knew that that's what it was. A bit like lockdown was a very blunt tool when we understood little about the virus. We now understand a lot more about risk. We know which patients suffer most from this virus, and that list has changed actually quite significantly since March. We know, for example, that obesity is now a major problem for this virus. We know that heart failure and diabetes are more risky than we thought they would be for a respiratory virus. And still the respiratory diseases, and the principal risk is still age. So any graph that you see, the principal risk factor involved is still age, unfortunately. And there's nothing we can do about those risk factors, except some of the ones that we have personal responsibility for, not our age, but we could reduce our weight, for example, or control our diabetes more. That means that the information and advice to the, let's call them the at-risk group, should change over time. And I don't support a return to full shielding, nor does Gregor. We don't think we should do that again. The social costs of shielding are too high. But we do think that at-risk group should have as much information as we can give them in order for them to adjust their behaviour, their family to adjust their behaviour, and et cetera, et cetera. And this week, Public Health Scotland changed their dashboard to be able to be much more local. So you can now see in your, even below your postcode level, I think about 4,000 addresses, you can now see very low, very good numbers. So colleagues in an Ayrshire town could now look very specifically about their risk of going to the supermarket or their risk of going to meet somebody outdoors, and they may make individual choices about family and friends dependent on that. It's just one element. The other place where the at-risk group is crucial is in the workplace, and one of the innovations is there is now a risk assessment, individual risk assessment online that you can do either as an occupational health department, an HR department, or you as an employee can do it. It won't give you a score out of 10. It's not as exact as that, but it will give you some understanding of your own risk and your employer some understanding of your own risk. And the unions have been helpful in distributing that, using that in factories, in offices, etc. And I think that's important. That's about you taking responsibility for your individual risk.
That's really very, very helpful. Thank you both for answering that question. I wonder if I could ask another one. It's really about the increasing numbers that we've been seeing for the last week or so. Is there any analysis on how the virus is being transmitted within these greater numbers, or is that something that we might have to wait until later on today to hear more about? It's a question that the public are asking me, like where is it rising and how is it rising over recent weeks?
I think that information is information that should be available later today. I don't know how much Jason feels he can say until that is published, but I think that information will be available to you and to others before the end of the day.
Okay, yeah, okay, I'm happy to wait for that. Jason, unless there's anything you can give us at the moment about it?
I would simply tell you, Mr. Coffey, that it's not an exact science, unfortunately, and Test and Protect interviews every positive case, so we don't have causation, but we have association. So we know where people have been. We know they've been at the Greek Islands, or they've been in Manchester, or they've been in Aberdeen, and we know if they've been in a pub, a restaurant, or a family home. What you can't always do is if they were in Greece, then in a pub on the way home, and then went to see their mum, you can't tell exactly where the virus came from. We can sometimes do that with genomic studies, with genetic studies, but that takes a long time. But we know that the virus spreads in poorly ventilated, close together crowds. So it doesn't take that much of a public health degree to work out where that might happen. We know that about 40% of positive cases report social interaction, approximately. And we know that a reducing number into the low single digits now report international travel, for example. So that allows us to decide where we should restrict and what we should, or what advice we should give to those who make the decisions about those restrictions. But we're hoping to publish more evidence on that question today, and that will go to the most common question we get asked, which is, why can I do this and not do this?
That's very helpful as well. Thank you both for that. Just my last question, if I may, on one of my favourite subjects, football. Professor Leach, you mentioned Stadia and you mentioned Germany. First of all, where are we in terms of the virus in Germany compared to Scotland? Because we do note, and constituents tell me, that they have managed to reopen some of their football stadiums and admit supporters in limited numbers. So if you could just give us a wee indication of where you think we are compared to the German situation, and how far do you think we might be off from allowing more supporters to come back into the grounds to watch their football club? Thank you.
Thanks, Mr. Coffey. This has been very prominent, as you know. Football supporters always choose Germany. They never choose Spain, where the stadia are shut and the numbers are rising. They never choose England, who have gone backwards and closed even their pilot events. So, depending on which argument you wish to make, you can choose your appropriate country. I can do that too, of course. I plead guilty to doing that sometimes myself. Germany is doing relatively well, but it is fragile. And what they've done, partly because of their size, is they've taken a much more regional approach than we have. But those regions are about the size of our country. So they are making choices for, I think they have 12, maybe 13 or 14 regions. And the last time I looked, 7 of them had open stadia with very restricted numbers, and 5 or 6 of them had no stadia open. So they're allowing slightly more devolved responsibility for that decision making. I don't think that's a stupid idea. I think that's a good idea. They're also, as we did with our pilot stadia, doing local travel only, no away fans, all the things you would expect. Keep away the at-risk people we've just described. And that's where we were headed. And good relationships with the SPFL. Mr. Fitzpatrick met them again yesterday, principally about financial support. But in the background there is always getting the crowds back, particularly to the lower league clubs who really rely on that relatively small crowd to get financial sustainability for smaller clubs. We're very mindful of that. Just now, because of the prevalence, it is not safe, we don't think, to do that. When it is safe to do that, I will be a big advocate for doing so. And there are a number of other advocates in Cabinet and in the public health advisors that I promise you, Mr. Coffey, fight that good fight.
Okay. Thank you both very, very much for that. Convener, back to you. Thank you.
Thank you, Willie. Our next questions come from Maurice Corrie.
Thank you, Convener. Good morning, everybody. Can I just touch on the question about the visiting of older people who are on their own and also have no access to outside space in their accommodation? What steps can be taken to try and alleviate this issue? Because obviously we're dealing with people who may have underlying health problems, and obviously this is a concern. But we're putting them at a severe disadvantage, particularly in relation to their mental health state. I'd ask you to comment on that. Maybe Jason Leach, you might like to make a comment on that.
So it takes me back to my emotion question, Mr. Corrie. You're absolutely right. This is probably the toughest group and the toughest pieces of advice we've had to give, not only for care homes, but for those. Remember, there are more older people receiving care at home than there are receiving care in care homes. The challenge here, of course, is that is exactly the group who are most at risk of this particular virus. So there is a horrible balance in there of risk from the virus, risk from loneliness, and I have friends and family members in exactly that position, as I'm sure you and others on this committee do as well. Those individuals are allowed to have an extended household. That doesn't have to be a family member. That could be anybody. It has to be restricted to just that restricted household, that extended household. So you're allowed to do that with friends, not just family. You are allowed to go to cafes and be distanced. And I know a lot of people find local cafes a huge lifeline for that group of older people. So you can meet your pal there or go with your family there. I hope that we will be able to remove the indoor restriction just as fast as we possibly can, because I know some older people will be scared to go out, scared to do that, and they would much rather receive individual visitors. I'm very mindful that in our impossible list of priorities, that has to be the number one priority, to deal with that elderly cohort and the loneliness that this virus brings. It's horrible.
Yeah, I think, Convener, yes, exactly. Thank you, Professor Leach, on that, because I think it's that last point about that they're being frightened to go out is a big question. It brings me on to this other question about flu vaccinations for our older people, particularly those who are in the range that are entitled to have it now. I'm getting on from my constituents issues about the fear of going out even to get that vaccination, and question about more publicity to make sure that these marquees, because I mean, people are having them in marquees and in schools and not in the medical centres, obviously, for various reasons. There is a fear running around. What are you doing to counteract that, to make sure these people do go out and attend and have their vaccinations? And again, Professor Leach, maybe you'd like to comment on that.
Again, I'm hearing the same thing. A couple of things around the challenges here, not to excuse it, but just to underline the challenge. We're trying to vaccinate 2.5 million people, the most we've ever tried to vaccinate. And the vaccine can't all be done on the same Tuesday for the whole population. It just is logistically impossible. So it has to be staggered, and it has to be in places where we can take more people than previously. We can't put all of that onto GPs, because that's all they would do. They would have to stop doing everything else. In some places, the GP practices can do it, small, more rural, more local. So we have had to ask the primary care environments, the health boards, to think a little bit more. So some people are using not quite the football stadia, but the conference rooms within the football stadia to do it. Some people are doing it outdoors. So we need patience. There isn't that much flu circulating yet. It's the 7th of October. The flu season is beginning. We're not in the peak of it. So there is time. So people don't all have to panic and get the virus by Friday, get the vaccine by Friday. But we do want people vaccinated as fast as we can. I do see on social media and in correspondence with me, some people who are queuing up outside in the cold and the wet, and I don't like that any more than them or than you. So there have been some teething troubles, particularly prominently in Fife in the media. We've corrected some of that. Fife have stepped up, new people, extra places. But it is a huge logistical exercise, and nothing to the logistical exercise we're then going to have for a COVID vaccine, which we'll hopefully get in the first half of next year. So we're sympathetic to that. We want to hear from people who are struggling with that access, and parliamentarians are one of the ways we get access to that kind of intelligence.
Right, thank you for that, Professor Leach. Can I ask one more final question, Convener? And it's on the question about the sales of alcohol in the off-sales sector. That's obviously retail, supermarkets and shops and off licenses. Has any consideration been given to moving the ceasing sales of alcohol back to 9 o'clock every evening? On the evenings, obviously, it's open any later. Has this ever been considered? And if so, on what basis has the government taken the decision not to bring it back to 9 o'clock? Maybe Mr. Russell might like to answer that question.
quite clearly, all options would be on the table and remain on the table, of course, in terms of additional actions which the government may have to take. The 10 o'clock figure was seen as not being unduly restrictive in terms of people's socialisation and access to pubs, but equally reduced the issue of night time, the night economy, which had been associated with some difficulties elsewhere. I think we remain, Mr. Corrie, alert to other options, and quite clearly some of those will need to be taken. You, if I may say this not disrespectfully to you, you and I are both old enough to remember 10 o'clock closing when we were much, much younger. Maybe there was an element of 10 o'clock closing that came back into this, but I certainly never thought to see it again. Obviously, we remain flexible on the matter.
Thank you. Thank you, Convener. Back to you.
Thank you, Maurice. Our final set of questions come from Stuart McMillan, please.
Thank you, Convener, and good morning, panel. Just it's a couple of questions. I want to go back onto the question of the 10 p.m. licensing. When the regulations were being put together, was there any consideration to having potentially two times, maybe potentially 9 o'clock and also 10 o'clock? Because going back to one of the questions from earlier, when you have the pubs and the social clubs primarily will be a place where older people will go to as compared to pubs. When you have everyone come out at the same time, it would then make it harder for people to get public transport and get taxis, get back home, compared to if there were two times, then it could allow older people to get their taxi trade to get more than one fare, and also then to have the second group of people come out at, say, 10 o'clock. Is that consideration given?
Well, in response, I think, to an earlier question, I made it very clear, I think, from Mark Ruskell, whatever time you set, there will be people coming onto the streets, and I think whatever time you set, there will be competition on the streets for whatever services are available, whether it be a kebab or a taxi. I just think that's unavoidable. And I go back to individual responsibility. It is not about the setting of times for pubs to close. You don't have to stay, until the very last minute and then leave. You can demonstrate your freedom of action and individual responsibility by recognizing that and making sure that you are not in a group of people, and making sure that there is substantial social distancing, and that you're wearing a mask, and that all those things are observed, which are required. So, I think we could almost infinitely talk about, would that solution be better than that solution? The reality is these are the solutions put in place for good reasons, try and make sure that they have an effect on suppressing the virus. We look to individuals to make sure that they regard these as useful, but they are not a Bible by which you should live your lives. You can leave a social club at 8:30 or 8 o'clock. You can leave a pub at 8:45 or 9:30.
Thank you. Bible actually takes me on to the second question, actually, regarding with the regulations, with the increase in number of people being allowed to attend funerals and wakes, which I think has been warmly welcomed. But on the issue of people attending churches, also the limit is at 50, but also all churches all come in all shapes and sizes. Has there been any other dialogue regarding potentially increasing the number of people being allowed to attend a church service, particularly for the larger churches and potentially cathedrals?
There has been, and of course continues to be, dialogue with the faith groups, and I think that's entirely normal. And I know there is an argument that a cathedral is different from a small parish church. I mean, there are actually very small cathedrals. I point to the Cathedral of the Isles, but the point is taken. I think we also have to have regulations are easy to understand and easy to implement. And if we were to undertake an exercise to grade through capacity every single church, I think we have been in some difficulty. Nobody wants there to be continued restriction on congregational worship or anything of that nature. But I really think, given where we are and what we described as a deteriorating situation, this would not be the time to say, let us relax further what exists. I mean, Jason Leitch at the very beginning of this referred to Larry Whitty's point about on the edge of what you could relax. Look at the figures. we're beyond the edge of what can be relaxed. So I think we have to accept reluctantly that where we are is where we are.
And my final question is just back to Willie Coffey's question about football clubs, but particularly the smaller clubs. And also, it's not solely about football, also rugby and other outdoor sports. Obviously, football is considered to be and is very much the national sport. And certainly with the smaller clubs, that small amount of people being allowed to attend, potentially having a limit of say 10%, would generally have a positive effect on the financial viability of clubs and also rugby clubs as well. So I know that Jason Leach spoke earlier about keep up that particular fight, but also has there been any further dialogue around that potential?
As Jason Leach indicated, Joe Fitzpatrick met with representatives this week. There continues to be dialogue, but I go back to this basic point. We are where we are at the present moment. The figures speak for themselves. The First Minister will be making a statement later today. I think if, as leaders, and I go back to that theme I've been using throughout it, as leaders in communities, we also have to be very straight with people. They see themselves the danger we are in. They see themselves the figures that are being produced on a daily basis. They, I am sure, recognise, and those in leadership positions need to recognise that to have a conversation now about relaxing restrictions, is. I think you just have to say it is going in the wrong direction. Figures are certainly going in the wrong direction. To have a discussion about whether you would relax issues now in the light of that, I just don't think is feasible.
Okay, thank you, Convener.
Thank you very much. Can I thank the Cabinet Secretary and his accompanying officials for their evidence this morning, and we will now move on to the next agenda item, item 2, which is consideration of the motions on the subordinate legislation that we have taken evidence on in the previous agenda item. Are members content for motions S5M 22704 and S5M 22856 to be moved en bloc? And if any member is not content with this approach, please can you type N in the chat bar now. Members are agreed to move the motions en bloc. So can I now invite the Cabinet Secretary to move en bloc motion S5M 22704 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions and Requirements Scotland Regulations 2020 SSI 2020-279 be approved, and motion S5M 22856 that the COVID-19 Committee recommends that the Health Protection Coronavirus Restrictions and Requirements Scotland Amendment Regulations 2020 SSI 2020/300 be approved.
Moved en bloc, Convener.
Does any member wish to speak on either of the motions? And if so, could you please indicate that by typing R in the chat bar now? I note that no member has indicated that they wish to speak, so I will now put the question on the motions. The question is that motion S5M 22704 and motion 25M 22856 be agreed to. Does any member disagree? And if so, please type N in the chat bar now. Can I confirm that the committee is agreed and that the motions are agreed to? The committee will publish a report to Parliament setting out our decisions on these statutory instruments considered at the meeting in the coming days. And that concludes our business for this meeting. Can I extend my thanks to both colleagues and the Cabinet Secretary and officials for attending? And can I also advise that due to the October recess, the next committee meeting will be scheduled for Wednesday, the 28th of October, and the clerks will provide members with further information about that meeting in due course. And I now close the meeting. Thank you.